Hello everyone, welcome to the channel Blissful Mind. And today let's discuss about the topic generic medicine. Before we get into the point, let's go with the basic point like healthcare services. These are the prime objective to achieve by any nations, and healthcare services should be accessible to each and every individual of the country. Yes, pharmaceutical industry stands on the rank third in terms of volume of exportation of medicines. Yes, and other countries call India as the pharmacy of the world because a large volume of medicines is exported from India to various parts of the world. Expenses on health are almost 80% of total expenditure. About 86% of this out of the pocket expenditure is dependent on the medicines alone. One of the economical options to improve healthcare facilities and to reduce this out of pocket expenditure on medicines is consumption of generic medicines instead of a branded medicine by the public. Then what do you mean by out of pocket? That the phrase is nothing but the expensive one. So instead of getting the expensive branded medicine, we need to consume the generic medicines. Usually from a single substance, two types of products are manufactured by pharmaceutical companies. One of the product is advertised a lot and also promoted by doctors or retailers or pharmacists called as a branded medicine. Another one is not advertised, promoted, and it is called as generic medicine. This is the basic difference between branded and generic. Another one and interesting fact is that both the drugs are formed by similar molecule. Hence, the formulation in both the drugs are similar, but the price is quite higher for branded one, and and the low is for generic medicine. To promote the generic medicines, Central Drug Standard Control Organization Consultant Committee in the 56th meeting has made a mandatory for doctors that they have to prescribe only generic medicines in 2008 by launching a program called Pradhan Mantri Bharatiya Jana Aushadhi. The aim of this program was to provide effective generic medicines to the people of the country at affordable price. And apart from this scheme, the Rajasthan state government in the year 2011 to 2012 they started a very huge and appreciable project called Mukhyamantri Nishulk Dawa Yojana, which was free medicines at government healthcare institutions. It was brought to community health centers and primary health centers. Despite of cost benefits with generic medicines, there is a lack of faith and confidence in generic medicines among doctors and patients as well as in terms of quality. Doctors are usually underconfident because regarding of this generic medicines because efficiency of generic medicines and unknown hygiene standard of manufacturing pharmaceutical companies are the reasons for the lack of confidence or faith in generic medicines. Although generic medicines are clinically proven as effective as branded drugs, the trust regarding its use in general population is much less than required. Indian government is continuously promoting generic drugs. They're making time to time efforts for its promotion through making different policies. Yet its popularity among common population is not so appreciable. It is undisputed fact that generic drugs are economically cheap and affordable because generic drugs manufacturers do not have to spend extra money for its discovering and in trials. However, poor knowledge and negative attitude are the main hindrance of its adoption. In a study, the researchers observed that 66.2% participants showed their knowledge on generic drugs, whereas 72.5% know about difference between the both, like generic medicines and branded medicines. About 40.2% participants showed their negative attitude in buying generic medicines. Then, the poor knowledge, unfavorable attitude, and false perception of general population regarding anything can destroy benefit and advantages of any products like generic medicines in India, facing similar type of problems. General populations are the biggest uh, stone to achieve good care, healthcare, and coverage in India. Majority of the participants in the study they showed negative attitude towards the generic medicines. The medicines are the major expenditure for any country. Hence, it is very necessary for the people of the country to understand its importance. It is also demanded by government to educate and aware their population about this. Schemes such as Pradhan Mantri Jan Aushadhi and Mukhyamantri Nishulk Dawa Yojana. These are all commendable steps, and such more schemes are required in our country to encounter this issue. There is a need of more awareness and education in our country regarding benefits of generic medicines so that we can set a role model for the whole world as the um, country where we can find the medicines at lower cost, and it will be very beneficial for the people who can't afford high prices or money for the buying or purchasing medicines. And let's um, what at least from now onwards, just we need to know about the topic like generic medicines, what does it mean, and what the difference between the branded medicine and generic medicines, and what is the benefits of generic medicines over the branded medicines. These are all the basic things which we should to be know. Okay, and this is the topic for today, and I hope you get some information today in this video. If you like this video, please like, share and subscribe the channel, and thank you. Have a nice day. Bye bye.